Hi, everybody. Wanted to give you a quick overview of postpartum personal care with my handy visual aid. So, after you go home from the hospital, you will be bleeding. C-section or vaginal delivery, you will have discharge. This discharge will go from bright red to dull red to kind of pinkish brown to clear. Okay? You're going to get a peri bottle. I had craft time. Your peri bottle is to be used every time you go to the bathroom until your discharge is stopped, okay? You're supposed to use it. You don't even have to use toilet paper. You're probably wearing a pad. But especially while you're tender, after you urinate or poop, you rinse away the urine and the discharge with your peri bottle, okay? Um, do that until your discharge stops. If at any point your discharge smells bad, looks pussy, takes on a strange color, that's time to call the doctor. But, anytime you have moisture and discharge, that's a great way for bacteria to give you an infection. So using the bottle helps wash that away and reduces your risk. Ice cubes. If you pushed out a baby, put ice on your hoo-ha. If you had a C-section, put ice on your incision, okay? You can crush ice and put them into newborn-sized diapers, and put that against your lady parts for cooling. It also helps to absorb your discharge, so kind of a win-win there. Giant pads. You will start out in giant pads, and then you'll pretty quickly work your way to normal size menstrual pads. Do not use tampons for 6 weeks. Okay, nothing up in your vagina. Change your pads frequently. You don't want them to be smelling funky. They trap moisture, and that causes infection. Drugs. Most commonly, you'll be given Tylenol and Motrin. These are just common doses and frequencies. It's very common you'll be recommended to take 3 of the 200 milligram ibuprofen every 6 hours, or 2 500 milligram Tylenol every 6 hours, or both every 6 hours. If you're given a Percocet order, that has Tylenol in it. So you don't want to take too much Tylenol during the day. If you're taking Percocet, do not take Tylenol out of a bottle. No sex. This goes with nothing up your vagina for 6 weeks, okay? Your placenta left a wound, essentially, the size of a paper plate in your uterus. And that needs time to heal, and you don't want to be putting a dirty penis up in there, okay? If you choose to have sex before the 6-week mark, you need to use birth control, okay? You can get pregnant before you even have a period after having a baby. Breastfeeding is not enough. You need to use condoms, or another option is to get a shot of Depo before you leave the hospital. Birth control. Space out those babies. Okay? We come over here. There's something called Dermoplast. That is a numbing spray you typically get while you're in the hospital, and that can help your lady parts too. Witch hazel pads, also called Tux pads, are available at the pharmacies if you don't get any from the hospital. Put them in the fridge. They're soothing. You can wipe your lady parts. You can kind of gently press them on and then pull up your underwear with your pad in it. You can lay them across your pad. It's just another way to soothe angry skin. And sleep. You need good quality sleep. You're not going to get a lot of it, so the stuff you get, we want to be quality. Another thing about the witch hazel is if you had tearing or an episiotomy and have an incision, that's super helpful. If you have had a tear or an incision, you can do sitz baths or soaking baths. If you have had a C-section, you may not take baths, okay? That's a distinction I want to make clear. If you have a C-section, no baths for you. The other thing to note, if you've had a C-section, you're going to learn kind of where you want your underwear to hit. I preferred having my underwear on top of my incision because I would fold a peri pad over my underwear to both protect my incision and wick away any moisture. That's something you guys can do. Otherwise, some people just really prefer having underwear that goes up and above your incision. For both perineal incisions or tears or C-section incisions, you want to watch out for um, kind of gross discharge, bad smells, redness, itching, signs of infection. And that would be times to call your doctor. So that's taking care of the physical you after having a baby. Let's talk about your breasts. So if you're breastfeeding, your breasts are getting a lot of activity. They can be cracking, they can be sore, they can be bleeding. One of the best things for your breast is to actually express a little colostrum of breast milk on your nipple and areola and then let it air dry. Because if you think about it, your breasts are in your bra with pads probably. You're leaking a little bit. That's very moist. You're putting your breast into a moist baby mouth. They have no time to dry. And the breast milk has antibodies in it to help with infection. It has fat in it to help with moisturizing. So you don't necessarily need a whole tube of lanolin for your nipples. If you're not breastfeeding for whatever the reason is, what you want to do is you want to avoid stimulating your breasts. You want to wear a tight, very snug sports bra all day and night. When you shower, don't let the water hit your breasts. If you're going to have sexy time, even though not for the first 6 weeks, the breasts are a no-fly zone because they think if they're getting touched that they need to gear up and produce milk, and that can be very uncomfortable if you're not pumping or breastfeeding. Emotionally, you're going to be in for kind of a roller coaster in the postpartum period. In the very beginning is what's called the baby blues. They last up to 2 weeks, and that's just from the landslide of hormones that you're going through. If your baby blues last longer than that, if you're having extreme anxiety, sadness, bouts of crying, it's time to call your doctor and get seen. If at any point you feel like you're going to hurt yourself or your baby, that's a 911, okay? Postpartum depression can be treated between meds and therapy. If it goes untreated, it can turn into long-term depression, okay? They say, I think, 1 in 8 have postpartum depression. That's not true. It's much more than that. It's much more prevalent. So if you're having those feelings, talk with your doctor, okay? Otherwise, congrats on your new baby.